number of years with Gavi, and then before that with the U.S. CDC, where he was seconded to country offices as well as to the World Health Organization. And we're very pleased to have Steve with us today. So Steve, I'll turn it over to you, and please give us an update about Gavi support for hepatitis B birth dose implementation.
Hi, John. Thanks. And thank you very much for the opportunity to join the group today and to speak about Gavi support. I'm actually trying to, okay, I can. I wanted to share I just have a couple of slides to orient us. Let me know when you're able to, if you're able to see my slides.
Right now we're seeing, it looks like your whole screenshot. We're not seeing just the slide itself. See some vaccine program. There you go. That's better. Then if you just go, perfect, perfect.
Great. I'm gonna have to, whoops. I'm gonna just switch off I've had computer and bandwidth. Imagine that, bandwidth issues in Switzerland. But I'm gonna shut off my camera just for now to make sure I don't drop. Good, thanks everybody. First off, I just wanted to start with a slide to try to level set with the audience, some of whom may not be aware of Gavi's work. So this slide really is to illustrate the timeline of new and underutilized vaccines offered by the Gavi Alliance since its inception nearly 20 years ago. I also think that this slide is helpful to illustrate basically the size and the growing complexity of Gavi's vaccine portfolio that now, if I count correctly, supports routine and stockpiled vaccines of 17 infectious diseases. You can see over to the right, in a bit of a grayed out area, is where our newer approved vaccines fall, including hepatitis B birth dose. So the process by which new and underutilized vaccines make it into Gavi's portfolio is through a periodic process, so an evidence-based process that we call it the vaccine investment strategy, so VIS for shorthand. It's a process that is run in-house, but we draw heavily, and I can't underline the word heavily too much on external expertise. And I believe even there are a number of people on this call that participated in this process a couple of years ago. So how, again, does this process fit in? I guess with this pretty rudimentary slide, I wanted to just quickly inform people, again, of the major buckets, if you will, of support. So we have health systems and immunization strengthening support. And this basically includes health system strengthening support that we provide to countries. And it's made up of this support as well as operational support for vaccine introductions and support to roll out vaccines that are rolled out in a campaign or mass vaccination format. We then have vaccine support, and we'll talk more specifically about this. And this includes typically co-financing for that vaccine, where countries contribute to the cost of the vaccine. And the amount that a country contributes to the cost of a vaccine is dependent on their gross national income, a standard indicator that's used at the national level and provided by the World Bank. And then, of course, we have technical assistance over to the right. And we again, as alliance partners, WHO and UNICEF are key here because they are located in all countries and we are not. We only have staff based in Geneva and a small office in Washington, DC. But I think important to note there is that ever more it's not that we're not relying on our WHO and UNICEF core partners. We absolutely rely on them because they're essential to getting anything done at the country level. But we've been working increasingly with an expanded group of partners, depending upon the particular technical issue or thematic topic. And this includes networks of civil society organizations. So the VIS is focused, the vaccine investment strategy, and is focused on our vaccine support. And as I mentioned, this is our, our evidence-based periodic approach to prioritize new vaccines that are coming down the pipeline. Of course, for this discussion, it's not just new vaccines, right? It's also those underutilized vaccines that can have significant impact in countries, but need a bit of a nudge in different ways. I would just also mention that, for that innovation box, it's important as well to understand that through our market shaping team, we try to encourage the industry to develop product innovations such as different vaccine presentations and delivery technologies. This is separate from the VIS, but it's also important for optimizing to allow countries additional choices to be able to optimize their own particular context in running their national immunization programs. So there's a little bit packed into this slide, and I don't want folks to zoom in. And I mean, when I share the slides to you guys, you can zoom in and concentrate a little bit on these snapshots of these slides that I put on the right. Those are really basically it was a part of the key evidence that we brought to our board to make this investment decision in hepatitis B birth dose. So I know it was alluded to yesterday in a couple of the presentations by colleagues, and so everyone knows that the Gavi board has approved support for hepatitis B birth dose along with a number of other vaccines. The uniqueness about the hepatitis B birth dose is that at the time of this analysis and the decision, the per cost dose of hepatitis B birth dose was around 20 cents, and this 20 cents is key in the sense that this is the minimal amount of co-financing that countries are obligated to pay when agreeing to introduce a new vaccine supported by Gavi. And again, it's co-supported by Gavi, right? Because countries need to have some skin in the game, if you will. And so this presented some, I would say, some kind of policy level challenges that are for the Gavi Secretariat and for our partners to figure out what then, if we agreed that hepatitis B birth dose can be really impactful and cost effective, what then should the support be that the Gavi Alliance provides to help push this vaccine? Push is the wrong word, but to help encourage countries to introduce this vaccine. And the idea then here is that that Gavi would provide, again, non-traditional support. So not traditional support in the sense of vaccine support as we would normally provide for a new or underutilized vaccine, but that we would provide stronger support or support to strengthen that specific time point, which we know is a challenge at birth to deliver the vaccine at high coverage levels, which is really the aim of what we're trying to do. And so support would be for broader integrated service delivery platform strengthening to specifically help with hepatitis B birth dose, but also understanding that it doesn't exist in a vacuum on its own. And so really looking at the integrated delivery platform for other vaccines and other primary healthcare services. Now, I guess this is the bit of the unwelcome news. I won't call it bad news, but the unwelcome news. I mean, our plans, as many plans, whether they be public health or otherwise, have been thrown a little bit in terms of reacting and dealing with the impact of the pandemic. I've used this slide simply to illustrate where, from our perspective, the Gavi perspective, how countries are coping. And I know that yesterday, I think it was in Shalini's presentation, she spoke about the impact of COVID-19 on some of the tracer activities that are used to follow the performance of primary healthcare. This is super important, obviously. What I've used, though, here, I think is a bit more specific to Gavi and perhaps a better proxy for the impact of the pandemic on the capacity of countries to plan and initiate new programs. So we continue to track this performance. We've done it throughout the pandemic, and we're continuing now, obviously. What this really shows, though, is that if you look at the 68 column there, Gavi's plans with countries and partners were to introduce 68 new and underutilized vaccines through routine introductions or campaigns last year. Now, with the pandemic, we saw almost 2/3 of these delayed. So 43 of these were delayed, and still many of them have not occurred. Many of them, I would say most of them, have been pushed into 2021. And even in the first quarter of 2021, we have very few that have occurred. And so this situation, as well as other kind of markers of how stretched national immunization programs and other government systems are, led to the decision by the board in June 2020, it should be June 2020, that because of the impact of the pandemic, that the rollout of our new approved vaccines, which includes hepatitis B birth dose, would need to be deferred, and that we would reassess after we pass the acute phase of the COVID-19 pandemic. The length of this delay still remains to be seen. As I mentioned, we continue to track very closely with countries the impact of the pandemic on day-to-day operations of programs. Obviously, we are also not only doing that, we're very much supporting countries to try to maintain what's happening related to their routine immunization programs. But as you know, Gavi is also very implicated in the COVAX facility and working with countries to try to deal with the exigencies of dealing with the pandemic, which includes the rollout of COVID-19 vaccines. We are meant to go back to our board in June with an update to see if the guidance from the board changes. And so we'll be more than happy to update this group as well as to how the picture is shaping up on our side. So again, maybe not the bearer of the most positive news from my side, but I do think that, and what I enjoyed yesterday was, I guess, just trying to bring myself up to speed as much as possible with what is happening in this space, because there's so many committed partners to driving this piece of work. There's a lot of work from our side, from the Gavi Secretariat side, that needs to move from beyond just the conceptual perspective to more how we actually design this program. And that is usually what occurs following a board decision, that we move towards the program design phase, and we continue to reach out and collaborate with our technical partners to be able to make sure that the program that is designed and the support, and again, this is a unique situation, the support that's provided is appropriate and adequate to allow countries to be able to introduce and try to scale up hepatitis B birth dose as best as possible. And so these questions are to the group. And again, it would be great to get feedback from folks either verbally or in the chat. The first question is really around that type of support, whether it be administrative or implementation activities that should be prioritized for countries as they consider applying for hepatitis B birth dose support. And again, understanding that it's not just an application to Gavi, right? I mean, there needs to be that in-depth discussion at the country level. The importance of NITAG discussions were mentioned yesterday, but understanding how that would play out would be helpful for us. And then the second question, and it goes back to my previous comments about the importance of other partners in helping us to deal with various complexity issues related to different and new vaccine introductions. Again, this is a new vaccine for us in many different ways. It's not a new vaccine, but it's a new vaccine for us in terms of how we support the rollout. And so getting feedback from countries especially, I know there's a fair amount of country participants about who they may see as being really helpful in supporting this unique time point within a life course style of vaccination. John, I'll stop there. Again, thank you for the opportunity and happy to field questions.
That's fantastic, Steve. Thanks so much for getting us all up to speed about the background of the decision-making process in Gavi and how it relates to the support for hepatitis B birth dose implementation and how that's been put on pause, as has been the case for vaccine support for other vaccines because of the response to COVID-19. For that explicit question regarding what support would be helpful for scale up, we can definitely begin to get feedback on that in chat, but we'll also put that out to the whole group after the meeting to try to get as many of those comments to you as possible. I think that's a very critical question, and I really appreciate you providing an opportunity to for everyone to give you that kind of feedback. I think and there's some questions for Shivanti as well. I know Kenneth Kavagumbi, who is a leader of a civil society organization in Uganda, had some comments in chat, and I wanted to give him the floor to present his comments or questions verbally. So if you want to go off mute, Kenneth, you have the floor.
Yes, thank you, John, for the. Sorry about that. Thank you so much, John, for the opportunity.